Hi, my name is Joanna Vasquez and I'll be completing my newborn assessment today. For my newborn, I will be using a teddy bear, and this blanket is going to be my warmer. So it's post-delivery. The baby was brought to me at the warmer. I have dried and removed all dirty linens, so this is a clean surface. In a row setting, we would have the proper equipment to weigh the baby, to measure the baby, and we'll have the warmer. Before beginning my assessment, I am going to raise the side rail so the baby doesn't fall or get injured. So I will step back, I'll let the equipment weigh the baby properly, and then I'll start with taking my measurements. I'm going to be using headphones to do this. So I'll measure the baby's abdomen at the biggest point. I'll measure the chest circumference, and then I'll also measure the head right there. And then I'll measure the baby's length from head to heel. And so now I'm going to listen to the baby's heart, lungs, and abdomen. And so while I'm doing this, I'll listen to the heart for 60 seconds. And then listen to lungs and listen to the abdomen. Heart rate should be between 110 and 160, and respiration should be between 30 and 60. I should be hearing abdomen sounds or bowel sounds. The lungs are okay. Some crackles are okay. That's just because the baby was just delivered and there was amniotic fluid in the lungs. So a little bit is okay. So skin, now I'm just looking at texture, at color, turgor. I'm looking for any rashes. On the bottom, I'm looking for the Mongolian spot, which will go away. It's very normal in babies. And everything's okay. Baby is nice and pink with the exception of some slight blue extremities. That's just because blood is going to vital organs and not prioritizing extremities just yet. So now moving on to reflexes, there's a Moro reflex, so that's where the baby gets startled. And so baby did have a positive Moro reflex. The blink reflex, I'm just looking at the eyes. He is blinking, and then I would check for reaction to light with the pen light. The rooting reflex, so that if I were to put my cheek right here, baby's mouth would turn to my cheek. And then I also have the sucking reflex, so I'm wearing a mask. I put my finger in the baby's mouth just slightly for sucking reflex, and then all my fingers in there, I'm also looking for the hard palate. And then palmar reflex, so if I were to put my finger on the baby's hands, on the toes, he would grasp my fingers. So now back to the head. I am just looking for molding for the shade, making sure it's symmetrical, for any depressions, for abnormal presentations. Sometimes if the baby's born vaginally, they will have like a cone head type, but that is completely normal. That's just from slight trauma, but it is normal from vaginal delivery. And so for the face, I'm looking for symmetry. I'm looking for any marks, lacerations. I'm also checking to see if baby's breathing okay, which if he's crying, he should be. So I will hold each nostril, making sure that his airway is patent. I'm also lining up eyes with ears. If they're not lined up, then it's not diagnostic, but it could be possible that baby might have Down syndrome. Also when checking the palate, making sure there's not a cleft palate or a cleft lip. So at the neck, I'm looking for any folds on the back. No folds. I'm making sure that the neck is freely movable, which he is when I checked my assessment. The rooting reflex, he was able to turn his head and he turned his mouth towards my finger, so that's great. And I'm also checking the clavicles to make sure that they're not broken or dislocated. So his arms going up and down his shoulders are freely movable, so that's really good too. And so then when baby would be lying down the whole time, this is just for demonstration purposes, but I'm also looking at the nippular area to make sure that if the chest was flat, then that would be a sign that the baby is preterm. But if they're elevated, then that's a sign the baby is carried to term. Also, I failed to mention another characteristic of term pregnancy is if I were to fold the baby's ears in, they would recoil back out. So that's a sign of term babies. I did check for abdomen sounds. I would clamp the umbilical cord, and I would also check the pulses at the groin. So checking for pulses at the groin also tells me if the baby has had a dislocated hip. That is also possible during delivery. And so I'm also checking for flexed extremities. If I were to turn baby on the back, I would see a C curvature spine. That is normal too. So if I were to put the baby prone, I would see baby crawling, and while the baby's crawling, I can check for symmetry in the buttocks and on the hips. Everything is symmetrical. Baby does not have any dislocated hips. And then moving on to genitalia. If the baby was female, then her labia minora and labia majora would be about the same size. For boys, I would check the urethra, making sure that it's at the tip of the penis, check the scrotum, palpate the testes to see if they've been distended. And I'm also going to assess if the baby has had a bowel movement yet. Sometimes babies will have their first bowel movement during delivery, and that's normal. The first bowel movement is called meconium, and the first pee will be bright yellow, bright in color. And I'm also going to make sure that before baby's discharged, they have their bowel movement and first void. And so also another thing I failed to mention was looking for jaundice. If the baby's skin is yellow, this could be a sign of jaundice. And I'm also going to check the sclera of the eyes. I would check the blanching of the skin. And yeah, overall baby is nice and healthy. And so I can return the baby to mom to make sure that there's bonding time for them. And then I would take the baby to the nursery to make sure that all vaccines and checks and first baths are being done. So thank you. That completes my assessment for newborn babies. Thank you.